Hello everyone, my name is Aarti Eka from second year 4 group. Today I am going to explain in about the mephtal spas. Mephtal spas is anti-inflammatory, painkiller and muscular relaxation. Mephtal spas contain mefenic acid and diclomine. Mephtal spas acid is help in reduce the pain where the diclomine it relax to the smooth muscles. So, mephtal tablet used to sympathetic relief of menstruation period pain, cramps, abdominal pain, and bloating, etc. Coming to the dosage, this tablet should be taken twice a day from 3 days after a food. We can use maximum it. Side effect of mephtal is heartburn, nausea, and indigestion. Who should who should avoid the mephtal tablet? People who have a liver problem, kidney problem, and pregnancy. And also the children less than 12 years of age should avoid the mephtal tablet. This is all about the mephtal tablet.
Hello, my name is Janvi Sharkey from second year, group 4A. Today I am going to give information about the phenobarbital. Phenobarbital is the drug or a medication that acts as a sedative and an anti-seizure medication. It is also used to treat patients in a withdrawal from barbiturate addiction. Barbital is classified as barbiturate that works by increasing the amount of time chloride channels having the GABA receptors. These are open, which depress the central nervous system. According to the DEA, barbiturates are the depressant that produce a wide spectrum of central nervous system depression from mild sedation to the coma. They also have been used as sedatives, hypnotics, anesthetics, and anticonvulsants. Phenobarbital is being studied that diarrhea and increase the anti-tumor effects. It also have been linked to the adenosynecrotic liver injury in rare cases. Phenobarbital is also known as luminal, hystex, and phenomenal. Here is the structure of phenobarbital or the history of the drug phenobarbital. Then we'll discuss how the phenobarbital works. According to the NIH, phenobarbital works as a barbiturate medication by acting on the GABA receptors, binding to their chloride ion gates, and increasing the amount of time the channels are open. Opening the channels allows for the hyperpolarizing flow of ions, increasing the action of potential, depressing the central nervous system action. It is metabolized the liver and is known for its rapid and complete absorption. Phenobarbital has been associated with some of the drug interactions should not given with a patient with history of addiction. Here is the side effect of drug phenobarbital: drowsiness, headache, dizziness, excitement or increased activity, especially in children, nausea, vomiting, slowed breath or difficulty in breathing, swelling of eyes, lips, cheeks, rashes, and fever. Risk and contraindications of the drug phenobarbital. Besides side effects, complications associated with phenobarbital use are coma, decreased effort to breathe, low blood pressure. These are the more common in geriatric patients. Do not stop taking phenobarbital abruptly, as this can, like other barbiturates, cause withdrawal system symptoms. It is necessary to taper off the medications. Barbiturates are contraindicated in people with barbiturate sensitivity, liver impairment, nephrotic syndrome, or past addiction. Careful consideration or interaction is necessary when there is increased risk of the complication. Alcohol must not be mixed with this drug while taking. Conclusion: phenobarbital is classified as barbiturate that work as an increasing amount of time chloride channels are open.
Hello everyone, myself Kuldeep Kumar Singh. I am student of second year OS International Medical University. In this video, we are going to discuss what is antipsychotic drugs. Antipsychotic are the chemical compounds used to treat a wide variety of antipsychotic disorders. And the antipsychotic medication fall into two different groups. The first generation antipsychotics are super effective in treating symptoms associated with psychiatric condition. However, they carry a high risk of serious adverse effect called extrapyramidal symptoms. There are four main first generation agents still used today. This includes haloperidol, haldol, fluphenazine, chlorpromazine, thioridazine. One of the most potent agent and used primarily for acute psychosis episodes associated with schizophrenia. This is also preferred agent for Tourette syndrome. Adverse effects associated with haldol includes extrapyramidal reactions, neuroendocrine effects, and a prolonged QT interval. The second generation antipsychotics are newer and have only need one around the last 3 decades. These medications have lower risk of extrapyramidal symptoms but do increase the risk of neuroendocrine such as weight loss, weight gain, diabetes, and dyslipidemia. Some examples of antipsychotic disorders include schizophrenia, bipolar disease, depressive psychosis. Schizophrenia is diagnosed as a chronic brain disorder with symptoms that include delusion, lack of motivation, hallucination, and unusual behaviors. This disorder can be disabling and is characterized by episodes where one is unable to distinguish between what is real and what is not. People with bipolar disorder have mood episodes that vary from one extreme to another. Period of mania can cause extreme irritability and risk behavior, whereas depressive episodes can lead to have loss of energy, fatigue, and woeful purpose. Depressive psychosis is different from regular depressive episodes due to decreased ability to distinguish between during time of increased depression.
Hello friends, my name is Hemlata Dhakolia from group 4A. In this video, I am going to explain you about the drug name as erythromycin. So let's begin. Erythromycin is a macrolide class of antibiotic used for the treatment of a number of bacterial infections. This includes middle ear infection, throat infections like strep throat, sore throat, pneumonia, traveler's diarrhea, interstitial infections. Moving forward to erythromycin's uses, bacterial infections of respiratory tract. It is also used for streptococcal pharyngitis, tonsillitis, mastocytitis. It is also used in the case of diphtheria, whooping cough, and tetanus. It is also used in sexually transmitted diseases like syphilis and gonorrhea. It reduces the infection in COVID-19 patients. Even though COVID 19 is caused by the virus, the main thing harmed in this virus in COVID 19 patients is respiratory tract. So, in the case of COVID 19, we give erythromycin to patient to reduce the infection and the intensity in the respiratory tract. Further, the thyroid fever, and the last, a typical pneumonia caused by the mycoplasma. Erythromycin mechanism of action. As we all know, every bacterial needs bacteria protein synthesis for survival. The erythromycin inhibits bacterial protein synthesis by an effect on ribosomal translocations. The drug binds to the same 50S subunit of bacterial ribosome. The mechanism of action. Erythromycin binds to this 50S subunit of bacterial ribosome that inhibits the translocations of mRNA, that inhibits the protein synthesis and prevents the bacterial for growing. The side effects of erythromycin includes epigastric pain, reversible hearing loss, hypersensitive reactions, vomiting, nausea, abdominal pain, and diarrhea. As we can all see these images. Moving forward to contraindicators of erythromycins, we should never give the patient erythromycin to the patient which have diarrhea from the infection with Clostridium difficile bacteria. To the patient which have low amount of magnesium in the blood and low amount of potassium in the blood, which have hearing loss, a skeletal muscle disorder, and the last, a type of abnormal heartbeat. As we can see in this image, we can see the abnormal heartbeat in the ECG. And thank you. That's all for the video.
Hello friends, myself Utkarsh Chavan from Group 4A and my topic for explanation is aspirin. Hello friends, myself Utkarsh Chavan from Group 4A and my topic for explanation is aspirin. So here we begin. Aspirin, it is a non-steroidal anti-inflammatory drug which is used to treat pain, fever and inflammation. Aspirin is commonly used as an anti-platelet medication due to its ability to inhibit platelets. Originally introduced as an anti-inflammatory agent, aspirin is used as a cardiovascular drug as well. The main function of aspirin is its irreversible function. Irreversibility inhibits both COX enzyme 1 and COX enzyme 2. Aspirin is usually taken orally and major proportion of the drug is absorbed by the small intestine. Now we'll discuss about the oral bioavailability of aspirin. It is 75%. Aspirin is also available as suppositories and IV preparations as well. Now we'll talk about how the mechanism of the aspirin. Now firstly we'll talk about in the bloodstream. Aspirin inhibits platelet function. This is its main function. Now here in case of arachidonic acid, which is converted into prostaglandin by COX enzyme 1, prostaglandin is converted into thromboxane A2 and which thereby results in the formation of platelet aggregation. The role of aspirin here is the main function is irreversible function. Aspirin reduces the formation of prostaglandin, thereby platelet aggregation. This will cause prolonged bleeding time. Now we'll see the second mechanism in the liver. Here aspirin is hydrolyzed to salicylate. This is an anti-inflammatory effect. Here it has no antiplatelet effects like in bloodstream. Salicylate elimination is primarily renal. Now salicylate inhibits COX enzyme 2, which reduces prostaglandin synthesis, thereby which reduces pain, fever and inflammation. Now we'll see the indications of the uses of aspirin. Aspirin is indicated in case of headache, musculoskeletal and dental pain. Aspirin is used in the short-term treatment of chronic pain, including osteoarthritis, rheumatoid arthritis. It is also used in the long-term management of cardiovascular disease. Aspirin is given to patients after myocardial infarction, immediately after myocardial infarction, because of the cardiovascular long-term management of cardiovascular diseases. Aspirin is immediately given to patients after myocardial infarction. Thank you. This was all about aspirin.
Hey guys, myself Harshal Balram Rathod. I am from Group 4A. I am going to explain about the opioid analgesics. Okay, what's basically opioid analgesics is? Substances which are extracted obtained or extracted from the crude Papaver somniferum, a poppy plant. So here we are going to explain about the morphine, which is the opioid analgesics. Morphine have analgesic effect. Simply painkiller. The generic name of morphine is morphine. Mechanism of action. It binds to opiate receptors, which have two effects. Whenever it binds to opiate receptors, there are two effects. There is CNS depression and decreased perception of pain. There is decreased perception of pain, so it is used as a painkiller. Morphine acts basically through three receptors. nu receptors, kappa receptors, and delta receptors. The side effects of morphine includes first respiratory depression, second confusion, third most important and most common sedation. As there is decreased pain, so the patient gets sleep early. Fourth, constipation. These are the side effects. Through morphine, we can diagnose the vital signs of patients. First, we can diagnose vital signs. Pain assessment, we can understand how much amount of pain, and third most important, respiratory status. So this is all about morphine. Thank you.